Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Catheter Access for Hemodialysis. Introduction. Hemodialysis is a treatment that removes harmful wastes and extra fluid from your blood. If you and your healthcare provider decide that hemodialysis is right for you, you will need a vascular access. This is the site on your body where blood is removed and returned. There are three main types of vascular access for hemodialysis. AV fistula, the preferred access. AV graft, which is used if you are unable to develop a fistula. Central venous catheter, a permanent or temporary access. This program explains the benefits and risks of a central venous catheter for dialysis. It discusses what to expect during the procedure. It also explains how to care for your central vascular catheter. Hemodialysis. Hemodialysis is a common treatment used to cleanse the blood. It is needed when the kidneys are no longer able to remove harmful wastes and extra fluid from the blood. Harmful wastes can build up in the body if the kidneys are not working. Dialysis removes harmful wastes and extra fluid from the blood. Hemodialysis is one type of dialysis. Peritoneal dialysis is another type. In hemodialysis, your blood is allowed to slowly flow through a special filter that removes harmful wastes and extra fluids. The clean blood is then returned to your body. Dialysis helps control your blood pressure. It also keeps the proper balance of chemicals like potassium and sodium in your body. Before you can begin hemodialysis, you need to have a vascular access prepared. The vascular access is a site on your body from which your blood is removed and returned. A vascular access needs to be prepared weeks or months before you begin hemodialysis. The dialysis machine has three functions. Pump blood and watch flow for safety. Remove harmful wastes from the blood. Watch your blood pressure and the rate of fluid removal from your body. The dialyzer, sometimes called an artificial kidney, is a large canister containing thousands of small fibers through which your blood is passed. Dialysis solution, which is the cleaning fluid, is pumped around these fibers. The fibers in the dialyzer allow harmful wastes and extra fluids to pass from your blood into the solution. The solution then carries them away. The dialysis solution, also known as dialysate, is the fluid in the dialyzer that helps remove harmful wastes and extra fluid from your blood. It contains chemicals that make it act like a sponge. The goal of hemodialysis is to clean the most amount of blood possible during the treatment. The vascular access should let high volumes of blood flow continuously. If you develop acute kidney failure or your kidney disease worsens quickly, then a venous catheter will be placed as a temporary access. It will work for several weeks or months until your permanent access develops. Occasionally, the catheter may be your permanent access. The catheter. A temporary catheter for hemodialysis is a soft, flexible tube. It is inserted into a vein in the neck, chest, or groin. It is inserted using a local anesthetic. You may feel some pressure during the procedure. The catheter is the size of a drinking straw and goes into a central vein that leads to your heart. It has two inner tubes. One tube takes blood to the hemodialysis machine, and the other tube returns the blood to you. The ends or limbs of the catheter sit on the skin on the outside of your body. A catheter can be used for dialysis as soon as it is inserted. A catheter will work for several weeks or months until your permanent access develops. The catheter is not a permanent access. If you were hospitalized and needed a temporary catheter to receive dialysis, it will need to be replaced before you receive your dialysis treatments at an outpatient center. If you were not hospitalized, the catheter placement will be done as an outpatient procedure. The temporary catheter is replaced with a central venous catheter, also known as a permacath. A permacath insertion procedure is done under local anesthesia with sedation in the interventional radiology or IR department. Your healthcare team will wear masks, sterile gowns, and lead protective aprons during the procedure. The catheter is inserted into the blood vessel in your neck or upper chest under your collarbone. The catheter is then threaded into the right side of your heart, the right atrium. A tunnel is created under the skin to thread the other portion of the catheter out through the skin. The catheter may have a cuff, which is a small fibrous band. The cuff holds the catheter in place under the skin. The tunneling process reduces the risk of infection. It also allows the catheter to remain in for a longer period of time, between 1 to 12 months. The opening in your skin where the tubes come out is known as the exit site. The site will be covered with a sterile dressing. A one-piece junction hub will be visible where the two tubes or limbs are sitting on your skin. They have color-coded clamps and hubs. One is red and the other is blue. The plastic clamps and end caps keep the blood in and the air out when the catheter is not in use. Red is for the arterial line, which sends the blood to the dialysis machine for cleaning. Blue is the venous line, which returns the cleaned blood to the body. The lines will lie on your skin with the clamps closed. They will be wrapped in gauze and taped to your chest after the dialysis treatment for your safety and comfort. Occasionally, the permacath or dialysis catheter may be your only access. It will become your permanent access. Advantages of a catheter for hemodialysis. It can be used as soon as it is inserted. Your catheter will be connected directly to the dialysis machine. No needles are needed to connect you. Disadvantages of a catheter for hemodialysis. You usually use a temporary device for weeks to several months until a permanent access is created. The insertion site may become infected. The catheter exits the skin and is sutured and taped to your body. Without proper care, bacteria from the skin may enter the bloodstream and cause a serious infection. You may not have a high enough blood flow needed for enough dialysis. You may develop blood clots that block the flow of blood through the catheter. If you can, you need to wear a protective covering while showering. The catheter can cause a narrowing of the major blood vessels. A catheter access is the highest risk dialysis access and should be used only as a last resort. If you have a catheter access, please ask your doctor to send you for an AV fistula or graft as soon as possible. As soon as the AV fistula or graft has developed and can be used for dialysis, the catheter access can be removed. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. How to care for your catheter. The following section includes tips on how to care for your catheter. Don't get the dressing wet or remove the dressing. You can continue doing most of your normal daily activities. After the procedure, you may have some minor pain for 1 to 2 days. You may have bleeding at the site. Report to your healthcare provider any bleeding that continues or increases. Always wash your hands with soap and water for 20 seconds or use an antibacterial gel to clean your hands before you touch your catheter dressing. Be careful when you take off your clothes to prevent the catheter from getting caught or pulled. When you go for your dialysis treatment, wear a buttoned shirt or blouse so it can be opened. It will make it easier for the nurse to care for your catheter. Be sure that your dressing is clean and dry during and after dialysis treatments. You need to wear a surgical mask when your dressing is being changed. You are being connected to or disconnected from the dialysis machine. Make sure that your nurse at the dialysis center wears a surgical mask and a face shield. Your nurse should wash their hands and use clean gloves when changing your dressing, connecting, or disconnecting you from the dialysis machine. Ask your healthcare provider if you are able to shower using a protective cover over your dressing. When to call your healthcare provider. Contact your healthcare provider right away if you have a fever, flu-like symptoms, shortness of breath. You should also seek medical help if you have redness, pain, swelling, or a feeling of warmth at the exit site. These could be signs of an infection which may require treatment with antibiotics, catheter removal, and replacement. If your catheter starts to come out, tape the catheter in place to prevent more of it from coming out. Do not pull the catheter out. Do not push the catheter back in. Contact your healthcare provider. If your catheter comes out completely, apply pressure to the area right away. Seek medical care right away. During the dialysis treatment, blood in the catheter may become clotted. This could slow the blood flow during your dialysis treatments. If the blood does not flow at the right speed, your blood may not be cleaned as well as it should. Your healthcare provider will insert a drug into the catheter to help dissolve the clot. If clots develop frequently, the drug may not work. Your catheter may need to be removed and replaced.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Hemodialysis is a treatment that removes harmful wastes and extra fluid from your blood. If you and your healthcare provider decide that hemodialysis is right for you, you will need a vascular access. This is the site on your body where blood is removed and returned. A vascular access needs to be prepared weeks or months before you begin hemodialysis. You must follow a strict schedule when you start hemodialysis. Most patients go to a dialysis center 3 times a week for 3 to 5 hours each visit. The goal of hemodialysis is to clean the largest amount of blood possible during the treatment. The vascular access should let high volumes of blood flow continuously. A catheter for hemodialysis is usually temporary until the permanent access develops. Occasionally, it may become your permanent access for dialysis. Always wash your hands with soap and water for 20 seconds or use an antibacterial gel to clean your hands before you touch your catheter or dressing. Be careful when you take off your clothes to prevent the catheter from getting caught or pulled. Contact your healthcare provider right away if you have a fever, flu-like symptoms, shortness of breath. You should also seek medical help if you have redness, pain, swelling, or a feeling of warmth at the exit site, or if your catheter starts to come out. Thank you for using Explain.